Good. I've had a convoluted background, really. I started off as a clinical dentist. I worked a bit for about 3 years as a clinical dentist, then went into public health management, and currently doing health systems research. So health systems and health policy research. My current area of research is health systems governance. Specifically within the health systems governance, I'm looking at the role of decentralization in enhancing good governance within the health systems. It is an important area of study, in my understanding, is to me, and especially a lot to do with my previous experience as a public health manager, is I came to experience a lot of challenges first at operational level in ensuring that you work in delivering your role as a public health manager, and understanding that actually health systems governance is one of the probably least understood health system issue. That's what drove me into wanting to be part and parcel of addressing the challenges and the questions that face health system managers. Largely is because, particularly at the middle level, middle management level in the health system or in the health sector, quite a number of times is that the middle level managers are charged with the responsibility of interpreting policies which are set at what we'd call probably national level and translating them into day-to-day kind of management activities. And they're the ones also then who interface with the service providers and the service seekers. And there's always a lot of tension between what your understanding and your interpretation of the policies or instructions coming from above and what you can realistically do at a middle level management level. So it's that tension or the experience of going through that tension that actually led me into wanting to understand more, particularly how processes and how middle-level managers go about in making decisions and balancing challenges or issues that come in from above, and also addressing challenges and expectations from both service providers and service seekers at the lower level. It is an important area of study because for me, I find that not just the agenda, but actually I find the managers at middle level as most important probably arm or element in ensuring quality of care or delivery of desired good policies, because it is how they interpret and implement those desired good policies that actually lead into quality of care and general better health outcomes. So my view is that that understanding of the issues, challenges, and processes that go about in that middle-level managers undertake in going about decision-making and making choices and priorities at that level really have a big influence in ensuring quality of care. In my research area, I largely use qualitative methods. Basically lots of participatory observation, because in as much as I'm a researcher, I also see myself as an implementer in a role, because I'm interacting quite actively with policymakers, both at middle level and at national level. So I use a lot of what I call participant observatory methods, observations, and lots of other qualitative exploratory methods like interviews and discussions with participants. My data is not really kind of quantitative, dealing with statistics, but rather dealing with perceptions and realities. And I think what I'm coming across or have come across as interesting discoveries or realization in the process of conducting my research is what I call the coping mechanisms that middle-level managers undertake or do take to ensure that the balance between, they strike a balance between instructions from above and realities with the day-to-day challenges when it comes to interpreting that. And just that revelation that different ranges of managers have different coping mechanisms in terms of trying to please, for lack of a better word, to please both their superiors at national level, but also be able to meet the expectations and the desires of the people they're managing, who are frontline health workers, and the service seekers who are seeking health services. So what I find as probably the contribution or the impact of my research work into the health system, particularly where I'm working in Kenya, is that first is my the type of research that I do is really operational level and directly feeding back on what we call real-time feeding back into improving the system, particularly working with managers in helping them to make decisions, or decision-making priorities. So I'm involved a lot as part of my research work, which is part of the methods that I'm using, is working on ways of enhancing decision-making at an operational level, management level. So helping health workers to devise ways and means of maximizing decisions based on different ranges of choices that they would have. So in that way, yes, I do feel that I'm making a very big kind of real-time contribution into the range of choices and decisions that middle-level managers do undertake to be able to deliver on their duties and mandates in managing the health systems or the health sector at that level. I have a dual role in my current position or in my current research work. I am in fact principally an employee of the Ministry of Health in Kenya, but have been seconded to a research program where I do undertake public health research. And part of my role, which is around which my body of research is focused, is also facilitating the translation of evidence into decision making at policy level, both at middle level and at national level. So and that then is around, I mean, my whole research work is revolving around that, how managers are able to harness and use evidence in decision-making processes. If you had asked me about 10 years ago whether I wanted to be a researcher or not, probably would have said no. But, and I was very clear when I was in the medical school, I just wanted to be a clinician, and I went out there with a lot of expectation and interest and enthusiasm to be a clinician. But the realities and challenges and experiences that I faced in working in the public sector is what actually made me start asking questions, is how best can we, working within type of environment and with the knowledge that I got from training, how can I help in enhancing and ensuring that actually not just me, but other health workers and other clinicians can deliver their mandate better or can offer services better. So it was, my research career was more influenced by my own experiences, both as a front-line clinician and also a public health manager.